My name is Ashley, and today we're going to do an assessment of the eyes, ears, nose, throat, and mouth. So I'm going to start off by asking you if you have any history of any eye problems or eye disease.
No.
Or any trauma or injury to your eyes.
No.
Okay, I'm going to note that your eyebrows extend from the inner canthus to the outer canthus, and they are symmetrical. Your eyelashes bilaterally both curl out on the upper and lower eyelids. Your sclera is white with no drainage noted. The lacrimal apparatus does not appear to have any swelling or edema. And I'm just going to push here on your lacrimal duct, and there is no regurgitation of fluid in the duct. I'm going to take a look at your cornea. There doesn't appear to be any abrasions. And I'm going to just shine a light into, okay, and the corneal light reflex is intact. You could also do a corneal reflex exam where you would use a cotton tip applicator to touch the cornea. Each eye will blink, and that would be a bilateral response. We're going to move on to the iris. The iris is round, consistent with color. When I performed the light test, there was that would be a direct response, and the eyes were equal, round, and reactive to light. I'm going to just touch my finger to your nose, and you're going to follow my finger to your nose. The pupils will constrict, which is present here, and when I follow my finger to the left and to the right, and the pupils stay dilated, that indicates that the accommodation is intact. We're now going to test for extraocular movement. I'm going to put my finger in the path of a big H, and I'll just have you follow. So up, down, up, and down, and back. All right, and there was no nystagmus noted. The extraocular movement is intact. We'll now do a peripheral vision test. I will have you just cover your left eye, and I'm going to move to this side and tell me when you can see each my hand movements.
I can see it. I can see it. I can see it.
Okay, and we'll do the same with the other eye. So you can cover your right eye now, and
I can see it. I can see it. I can see it.
okay. Okay, so the peripheral vision is intact, and I will now do a convergent test. So I will take my pen and put it to the tip of his nose, and that is also intact. We also have done the Snellen eye chart, and he has a 20/20 vision. He was able to read that line. We're going to move on to an assessment of the ears. The outer canthus is in line with the auricle, which is a normal finding. The ears are at least 4 to 10 centimeters in length. I'm just going to do the tug test where I'll pull up and back on your auricle. Is there any tenderness there?
No.
And same with this one. No tenderness noted. I'm going to now use my otoscope and inspect on the inside of the ear canal. So I would pull up and back on the pinna insert my otoscope, and I will note that the canal is pink. I can see the tympanic membrane, which is pearly and gray, and there is cerumen present. We're now going to perform a couple of hearing tests. I'm going to start off with a whisper test. So I will whisper something, and I would like you to repeat it.
I love you.
And so he has heard 100% of the words. I'm now going to do a Weber test, which I will use a tuning fork. I will activate the tuning fork so it sets off some vibrations, and I will start by setting it on the top of your head, and you would let me know when you can no longer hear it.
Yep, can't hear it.
Okay, and I'm going to do, so he could hear on both. When I did that, could you hear on both sides equally, or more on your left or more on your right?
Equally.
Okay. So that indicates that he could hear on both sides, both ears bilaterally. I'm now going to do the Rhine test, which tests for bone conduction and air conduction. So again, I would activate the tuning fork and set the tuning fork on the back of the ear here at the mastoid process, and you would let me know when you can no longer hear it.
Can't hear it.
Okay, and then I will do it again right in front of the ear, and you can let me know when you no longer hear it.
Can't hear it.
Okay, so when there is intact hearing, the air conduction would be greater than the bone conduction, and that was the case for this patient. We're now going to move on to an assessment of the nose. I'm going to ask you if you have any history of nosebleeds, changes in smell, congestion, or drainage.
Nope.
Okay, so the nose, will note that it is midline and same color as the rest of the face. I'm just going to palpate your nose. Any tenderness there?
No.
Okay, and so there is also no nasal flaring noted. I'm going to use my light and inspect in the nares. Could you just look up for me? Okay, there is fine vellus hairs noted in the nares. They're pink and moist. I don't see any lesions or drainage, discharge. And then could you occlude one side of your nose and breathe in, and then do it to the other side? Okay, and that indicates that the nares are patent bilaterally. We are now going to move on to the sinuses. Do you have any history with sinusitis?
Yes.
Okay, and so he may feel some tenderness upon palpation if he was actively experiencing sinusitis. So I will palpate the frontal sinuses, which are located above the eyebrows. And is there any tenderness there?
No.
And so then I will also now palpate the maxillary sinuses. And do you feel any tenderness here?
Yes.
Okay. So that would indicate rhinosinusitis involving the maxillary sinuses. I could also use a light and hold it to the sinuses, which would transilluminate them, and you should be able to see a red glow, which indicates that the sinuses are clear. So I could do this, and I just see a red glow, and I would do that to both sides. We're now going to go to the mouth. And do you have any history of bleeding gums, toothaches, lesions, or difficulty swallowing?
No.
Okay, so I will note that The lips are symmetrical, pink and moist. Could you smile for me with your teeth? Okay. The teeth are white. Gums are pink and well adhered to the teeth with no retraction noted. They are evenly spaced. Could you open your mouth? I'm going to take a look on the inside. Okay. And the hard palate, the transverse rugae is present, and the soft palate is pink and moist. Open your mouth again. Relax your tongue. Say ah. Okay, the uvula is midline, and I do notice +2 appearance of the tonsils. And so now I will have you put your tongue to the roof of your mouth. I'm going to inspect the floor of your mouth. This is where cancer is most apparent and more commonly found. And that is clear. The tongue moves freely in the mouth. I don't notice any lesions. Could you move your tongue to the left or the right? And again, no lesions noted. I would also palpate the tongue with a gloved finger and some gauze to check for any lesions on the sides of the tongue as well. And that concludes our assessment of the eyes, ears, nose, mouth, and throat.